When I joined this hospital, the teaching used to be done anywhere and everywhere, in the corridors, bedside of the patients, in the treatment rooms. We had no choice, but we had to carry on because you needed to show people some things that is needed for their own training. While you are teaching, you'll be teaching on a real human being, and you show some people this is how you do this procedure. But you cannot repeat that procedure on that particular patient because they have already gotten their own procedure. For example, if you're putting a drain, chest drain, you put it once, you cannot put it several times on a particular patient. Those were some of the few challenges that we had.
Before the skills lab, the students used to have difficulties when they come for placement. It was difficult to know which help they really need. We don't know where they are lacking, and the practicing on a patient, it was very difficult for the students because they didn't have that confidence. We had a situation where we had an emergency obstetric. We sent a student to prepare MAGSA. The student went for good. And later on, when she was approached, she said, I didn't know how to go about it.
Once this facility was commissioned and handed over to us, we experienced an improvement in terms of the confidence of how the students were coming out in terms of procedures, in terms of the theories that they were learning, and in terms of generally interaction between themselves and the patients. Because they had the time they could spend on the mannequins in terms of taking procedures.
We've seen a lot of remarkable improvement, I think, post the setup of the skills lab. One particular example is neonatal resuscitation. Not all babies are born crying, apparently. So some babies need to be, aroused a little bit for them to be able to, oh, there's actually life. So sometimes, in the past, it used to be a very big challenge.
When we go to those skills lab, at least we're having a lot of preceptors to guide us, and that is really helping us because if we were to make mistakes, not on the actual patient, but really on the dummy, and we're being corrected there. And that's a very positive one on my side.
Ero nafikire kuchipatala. Fyali sana na file fwa bantu baranda. Bali mpokerera wino sana. Chakuti bali nsuminishe na mwana n'omwana nabanyina. Fila fya bantu baranda kwati abakufipatala tabatanga ta wino bofi. Baratanga ta wino sana. Bantu wanse babiri bali n'obumi obusuma.
Nena naishire mu chipatala. Tahwayo naishibe. Ebo naishibe baishere kunganda. Na yumfuira obubi sana na yambira okumfa lonely filamba fyalelengerera. In fact nalelira n'okulira nombera nakumenye bamukuka bali nkosereshere bali ndangira ati konseko naya abantu bali babuna te kushintira family ba bonsangwa na bena kunganda bamuka bali ndangira okutemwa bali ndangira n'ekikuku.
I am very much happy to have my first delivery and the first mother being a prime. I'm very much happy because I'm able to interact with her without having any challenges.
Over time, we've seen that our students are beginning to have these certain skills that their counterparts in the previous years did not have. These are learning in a better way because there's this experience they're having before they are given the actual people. So for us, we feel this is a very important milestone in our teaching as a facility. And we see that they are coming out with better skills, they're coming out with better knowledge. Generally, they're coming out with better confidence in terms of attending to the actual patients.